If you drink a lot of water, kidney stones will automatically dissolve. It is not entirely true. Frequent urination always means diabetes.
No, there are n number of causes. Diabetes is one of the common cause.
So men above 50 will definitely develop prostate problems. Is that true?
If you say definitely, there is nothing like always or never in medicine.
Hello and welcome to News Minute. This is Real Talk powered by Apollo Hospitals, Chennai. And joining me today is Dr. Nithesh Jain, urologist who works at the Apollo Hospitals, Chennai, Greams Road. Thank you so much, doctor.
Thank you.
And welcome to the show. So urology is a subject that people may not openly talk about. What are the most common problems that patients encounter and they tend to slightly ignore?
The most common problem what patients have is your urinary problems, like elderly male. They usually don't tell about urinary complaints. They feel it is just an aging problem. Female having urinary leak. And apart from this, urology also deal with oncological problems like kidney cancer, prostate cancer, kidney stones, as well as your sexual problem like male sexual health. So many times, many patients ignore it or feel shy to tell about that.
So what are the most common problems that people have come to you, for your consultation? Problems that they have ignored, they have not taken it seriously or until it became very serious.
And the most common problem is one is your urinary problem, like they will have increased frequency, urgency, or finding it difficult to pass urine, usually the elderly males. And apart from that, kidney stone, they are also very common, especially in this hot summer. It's quite common. Many patients, they ignore the stone diseases. They feel it will come out with many other medicines or home treatment. But that's not true. Many times, small kidney stone also can destroy the kidney. So if any of the urological symptom appears, better to consult a urologist at the earliest.
Doctor, in your 15 years of service or practice, have you noticed any lifestyle changes that could lead to kidney issues or urinary health? Like how it is different now, after so many decades?
See, definitely lifestyle diseases are related to urological health as it is to any other disease like blood pressure or diabetes. Like diabetes, if it is there, it can damage the kidney. So again, it becomes a urological issue. So you have to modify the lifestyle. Many of the kidney cancer, they are also related to lifestyle diseases like obesity, smoking, sedentary habit, blood pressure. This can lead to kidney failure, kidney infection. We see a lot of patients coming because of diabetes, landing up in ICU just because of simple kidney infection, what we call as urosepsis. So lifestyle plays a very, very important role.
You talked about, patients landing up in ICU. When problem becomes severe, that's when they actually think about, consulting a doctor.
True.
So many would not, consult a urologist until the pain is very severe. So what are some of the warnings that people should not generally ignore?
If you have pain on side of the abdomen, there's burning in the urine, fever, blood in the urine, these are all early warning sign of any urological disease. Passing urine very frequently, not able to hold the urine. So if any of the symptom persist, it's not getting relieved in few days, then probably it's better to consult a specialist.
So have you encountered patients who have ignored these warnings?
Quite a few. We see daily
And
day in and
what
day
is the common excuse?
Common excuse, many of the elderly patients, they feel shy, they feel it's just a part of aging process, so they usually ignore it. Females, they again feel shy to tell about their problem, they feel that is just part. So many of the patients, they ignore it. Many young patients, usually what happens, kidney stone pain is intermittent, it's not continuous. So today it can be there and it may not be there for next 1 week or 10 days. So it's an intermittent pain. So many a times patients ignore this pain and they just say, feel ki just chalta sort of attitude. And over a period of time, it can really damage the kidney. We have seen many patients who come whom we have to remove the kidney just because of kidney stones. Better to get it treated if you have any warning signs.
So the first thing that people do, probably in India, you may find a lot of patients who say that, okay, when I started getting this pain, I went for home remedy.
Yes.
I went for some other medicine. How serious are these cases, like going for home remedy or looking out to?
See, it all depends on the size of the stone, how severe the symptoms are. Small stone, usually they come out with water itself. So even whatever medicines you give, they are just more of psychological benefit. What we usually ask for a small stone, usually we ask the patient to drink a lot of water, so the kidney itself flushes the stone out. For large stone or stone which are small and not coming out over a period of time, then definitely it needs intervention.
Medical intervention.
Medical or surgical, whatever, we have to intervene in bed.
So there are so many myths about hydration, kidney stones and urinary infections online. What are the myths you wish people should stop believing?
About the kidney stone, one of the commonest myths is once you have a kidney stone, you should stop taking any milk or curd. Actually, that's not true. The most common stone is usually calcium oxalate. One of the most common type of stone is oxalate. So it happens because of the increased dietary intake of oxalate, or our body is absorbing more oxalate. So if you don't take milk or curd or any other dairy product, what happens? The oxalate gets excreted in urine and forms more and more stone. So it's better to take some amount of calcium in the diet in moderate amount, not very high. So it will neutralize the oxalates and it will excrete in the stool. So this is one of the most common myth which we encounter. They will stop taking any form of dairy product, milk, curd or any.
So you pointed out that this is something which is very personal, like elderly people may not say it because because they're shy, because they're concerned that, okay, how to open it up. So, men are usually very hesitant about this, about urinary or prostate related issues. Why do you think this stigma still exists? Like, is this because of lack of awareness, or is this a personal choice?
It's basically both. It's lack of awareness also, and secondly, most of the people, they believe it's a part of their aging process. They feel okay, even my friend or my colleague also is having the same symptom, and it is just they have to carry on. So they ignore most of the symptoms unless until it becomes very severe for them, or it bothers their day-to-day activities.
So when you have elderly parents at home, what should one do? Like, when you know that these are the issues that are related to aging. So how do you, take care of it? How do you keep an eye on, whether the elderly parents are encountering such problems?
See, nowadays even most of the major health checkup, they include prostate health, like your PSA, and many of the tests, they include Euroflow, ultrasound. So usually you can have a basic workup done after the age of 45-50, and in case most of the time you will know your parents or your elder ones who is there at home are going urine very frequently, or they are finding it difficult to pass urine, you should always discuss with them, tell them it can be easily treated. Most of the prostate problem, 85 to 90%, can be treated with medicine. They don't require any surgical intervention. That again is one of the major concern most of the elderly people they have, they don't want to undergo surgery. The fact is 85 to 90% of the prostate problem can be treated with medicine alone. They don't need any surgical intervention.
At a very early stage, if there is a proper consultation, then probably the issues can be resolved with the medicine.
Definitely.
And as a surgeon, what has been one personal interaction that you had with a patient that stayed with you emotionally? You must have treated a lot of patients. Can you recall some for our viewers?
See, again, one more common disease is penile cancer. Many of the patients, we have seen like few patients who come actually in very late stage. There will be a fungating mass which is coming out of the penis and it will be stinking. Many of the patients, they will avoid that just because they don't want to tell their children that something is growing there. So few patients we have encountered that who have come at a very advanced stage because of the growth in the penis, and they feel shy, very shy to open up, tell their kids or anyone at home. So in case if anything is there, it's better to open up, tell, because most of the disease urological Even the cancer one also can be treated very effectively if they are diagnosed early.
So preventing urological problems is something that is there in their own hands. What are the healthy routine that one should follow to prevent it?
See, we can take disease by disease. Like if we say about kidney stone, one should have enough water. The basic thing is you should titrate the intake of water according to color of urine. The urine color should be either pale yellow or clear in color. It should be transparent. If you are having a very dark color urine, then definitely the chances of having stone again is very high. So titrate it. So if you are staying in AC climate, AC room, then probably you need less intake. And if you are working in a very hot, humid climate, then you will need more intake. So there is no hard and fast rule ki you have to drink 2.5 to 3 liters. The best thing is titrate with your urine color. Secondly, do moderate amount of exercise. It really helps both for kidney stone. Obesity again increases the chance of stone formation. Have moderate amount of dairy products in your diet. You should not completely cut off. Other things like if you are a stone former, definitely there is a lifelong risk of forming stone again as compared to a normal person. If you come to your kidney failure, like many patients, they have kidney failure who need transplant or who needs medications. So in those cases, probably managing the chronic disease like diabetes, blood pressure is very, very important, because most of the time the root cause, one of the commonest cause of kidney failure in India is diabetes and blood pressure. So we have to manage that very properly. Most of the time early kidney failure, they need a nephrological consult unless until it's very late, where transplant is needed, urology comes to play. So again, there the lifestyle modification, managing the disease become very. Dietary again plays a very important role. We have to cut down on salt. Salt again is one of the enemy, you can say, of any kidney disease. So better, whether it is a stone disease, kidney failure, everywhere. If you are taking more stone, the chance of kidney failure increases further. So we have to cut down that as well.
Doctor, you pointed out about lifestyle changes, the manner in which you have food, the timings that you maintain, the amount of workout that you do. Particularly for people who are working in IT industry, they sit for a very long time. They have their timings are very irregular in terms of having food or grabbing something while they are working and all that. So how do you think all this impacts your kidneys, or like how they are vulnerable in having urological issues?
See, you have pointed out correctly. IT professionals, especially the young professional IT, they are very prone to many of the urological problems. One of the commonest problem is your kidney stone. What happens most of the time, they are indoors. Their vitamin D is low. Many of them are overweight. They drink less water. All this can lead to increased stone formation. Sitting is the new form of smoking, many people say. So again, if you sit for long hours, our many lifestyle diseases can creep in, and then many of these IT professionals usually have very odd hours of working, like they usually work with American timing or UK European timing, so they have very odd timing of work. Again, this can lead to like sleep disturbance or unhealthy pattern of eating, because you will not get anything right in the late in the night. So unhealthy eating. So all this can lead to many of the urological issues, and many of these patients, because of altered sleep pattern and all, can have sexual disturbance like erectile dysfunction also can have.
So have you encountered patients who have been part of IT industry who had all these issues and come up?
They are very, very common. We see almost, you can say, on daily basis IT professionals who are coming with all these symptoms, either stone or erectile dysfunction. Usually, that's what I said. Yeah, either they will have stone diseases, they will come with pain or urinary complaints, or many of them even have erectile dysfunction.
So these are all common problems that
common
you find
problem
now.
in young male.
It's young people mostly.
Yes.
So doctor, like we are talking about problems that young people encounter, young people also tend to do something. They immediately, if they get pain or if they have any issues, they'll Google and they'll check if there are any remedies. So these are common things that we get to, find on the internet. So I'll ask you these questions. So you should give us your answers, like what exactly is the factual position. If you drink a lot of water, kidney stones will automatically dissolve. As a urologist, what is your take?
I think this is false. This is not entirely true. If you drink more water, small kidney stone can flush out, but they will not dissolve.
Not dissolve, money?
They will not dissolve. They will not disappear by itself. So only small stone they can flush out, and it can reduce the incidence of forming stone again, but it will not dissolve completely, barring few types of stone.
So there is also another myth that frequent urination always means diabetes.
No, there are n number of causes for frequent urine. Diabetes is one of the common cause. There is prostate can have urinary infection, stone disease, especially when it is lying in the bladder or very low in the ureter, urinary tract infection. Sometimes bladder malignancy, if it is multiple bladder malignancy, they can have increased frequency. So there are n number of causes for increased frequency, not only diabetes.
So what is the acceptable time between, like if you pass urine now, what is the time gap one should have?
Again, I told you, it all depends on, there's no normal thing. If you are sitting in a very cold climate like this, what we are sitting, a very comfortable AC climate, probably you will pass more number of times. But if you are working in a hot, humid climate, then probably you will pass less number of times. So it is always better to titrate with the color of the urine, whether you are well hydrated or not. Our main goal should be, our body should be well hydrated. It should not be dehydrated, because once you are dehydrated, you have high chances of urinary infection, you have urinary symptoms, kidney stone, all this can happen.
So men above 50 will definitely develop prostate problems. Is that true? As a urologist, do you believe in the statement?
If you say definitely, there is nothing like always or never in medicine. So it's not like all the patients who are above 50 will have prostate problem. But definitely it's one of the common cause of urinary symptoms in elderly male.
Elderly male.
Okay.
UTIs will only happen to women. Is that true? As a urologist, do you
Again, this
agree
is
with this
not,
statement?
no, this is not completely correct. UTI can happen both in male as well as female, but it is more common in female because the urethra is very small as compared to the male. So they have high chance of getting urinary infection as compared to male.
So holding urine for long hours is harmless. As a urologist, do you approve this statement?
No, this is again wrong. We should not hold urine for a long time because it can lead to bladder dysfunction. If you hold urine, the tonicity, see, bladder itself is just a elastic, just like, imagine like a elastic balloon. If you stretch beyond certain point, it loses its elasticity. So it is similar to one elastic band only. So if you hold it, the bladder will get stretched, and slowly over a period of time, probably it will lose its elasticity and you will have bladder dysfunction. Plus you can have urinary infection if you are holding urine for a long time. So that's not a correct practice. If you have urge to pass urine, you can go and pass urine. Even many young female, especially we see, if they go to mall or movies, or they usually avoid using public toilet. Actually, that's not a correct practice. You can use public toilet safely, provided it's a clean place. You can always clean the toilet seat and you can sit there. You can use some of the sprays which are available in the market. You can clean it with tissue and you can use it. You should not hold urine, which will cause more harm rather than that public toilet.
So I see two types of, people who generally avoid doing this, and when they are using public toilet. One is they will hesitate to enter a public toilet, and two, they will avoid drinking water.
Both of them are wrong. If you have the urge to pass urine, you should always use the toilet, provided it's a clean place. Secondly, we should avoid drinking less water, because when you are moving out, when we are going to mall, most of the time you are very active, you are walking around, you will get dehydrated. So you should drink more water, otherwise you will start having burning in the urine, or you will have very dark urine which will hurt you.
So one common myth that we see on the internet is erectile dysfunction is always psychological.
It's not always psychological. Erectile dysfunction, one of the common causes is psychological only. As I said, like young male who comes because of erratic or sleep pattern or because of stress, family, financial, all this can lead to erectile dysfunction. But there are definitely organic cause as well for erectile dysfunction. So once a person have erectile dysfunction, he should definitely go and see a urologist rather than taking over-the-counter medications.
Over-the-counter medication or home remedies?
Usually, most of the patient they know the medicine like Viagra, one of the commonly abused, I will say, medicine. Most of the people they take. So most of the people usually they will take 1 or 2 tablets and try themselves before coming to a urologist. So avoid doing that. Always, if you have a symptom, consult a urologist.
And blood in urine is normal if there is no pain. Is that true?
No, that's not again true. See, blood and urine, even a single episode should be evaluated. It's not a normal thing. Even a person has single episode of blood in urine, whatever his age may be, he should get evaluated. And it becomes more important, especially when the person is more than 40 to 45 years of age, because there can be painless hematuria, what we call as medical term of blood in the urine. One of the common causes is bladder malignancy, which is a commonly present as painless hematuria, painless blood in the urine.
So what happens if these symptoms are ignored, if particularly, blood in the urine?
This, if we ignore it, some of the sinister diseases like malignancy, bladder cancer, kidney cancer can be missed, and later when they have second or third episode, probably it may be a very advanced stage when we are picking it up. So a disease can be treated very easily when we catch it up at the early stage. When it becomes very late, then probably we have missed the bus.
Thank you, doctor. Thanks for sharing all your insights with us. Thank you.
Thank you. Thanks a lot for having me here. Thank you.